Thank you very much. So we spoke about the work, and we're going to continue. And our work is going to be about the relationship between the work carried out during the pandemic and health. So this work was significantly impacted by the COVID-19 pandemic. During the lockdowns, all non-essential businesses were closed, and remote work was obligatory when it could be done remotely. The different public measures, such as furlough, made it possible to preserve employment, but also to temporarily protect employees from infection. First line and second line professions saw their hygiene and safety measures evolve in line with the measures recommended by the state and implemented by their employers. But the situations were very different, depending on the sector, depending on the profession, depending on the type of employment. And they evolved more or less over the health crisis. So what we are proposing here is a clarification of the effects, or the diversity of the effects of the pandemic on one's professional situation, and to demonstrate the direct and indirect links with health. So for this work, we are using the Epicov study conducted by Drees and Inserm with the help of Insee and Santé Publique France. So two researchers, Nathalie Bajos and Josiane Varsevsky, created a team of 10 researchers to develop in record time a questionnaire to study the links between living conditions and exposure to the virus. This study was conducted online or on the phone. It consisted of interviewing people of 15 years of age or older. In order to monitor the evolution of the pandemic and its consequences, several rounds of the study was conducted. A number of people responded to the first wave of the study, which was conducted in May, so just after the study we just mentioned. 110,000 people took part in the second cycle in November 2020, so that was just after the second lockdown and during the second lockdown. And 85,000 responded to the third cycle, the third round, in the summer of 2021. So in the first part of this presentation, we're going to see how the specific conditions of work evolved during the epidemic. And we're focusing here on people of working age, so 18 to 65 years of age, who answered or responded to the first two rounds of the study. That's 46,000 women and 37,000 men. So thanks to this study, we can see the individual evolutions before the first lockdown in May 2020 and then in November 2020. So here we see the women that are represented here on this graph. So we looked at 7 different statuses. So in dark blue, no activity, so either studies or retirement. Then the next block is unemployment or seeking employment. In orange, it is work that is conducted in person. In light orange, it's remote work, and we here make a distinction between exclusive remote working and a hybrid remote working, and some working on site. And then we also have the different annual leave days, including sick days and holidays. And the grey areas represent the different flows between these different statuses. So the first observation that we can make is that thanks to the measures taken to preserve employment, there were very few flows between inactivity, unemployment and employment, particularly during the first lockdown. However, and this is the second observation, women who were working before the pandemic saw a wider variation of situations. So for the first lockdown, a quarter of women were working in person. 11% were unemployed, and remote work increased significantly. 8% of women were working in a hybrid model, so sometimes at home, sometimes in person. In autumn 2020, the return to work was significant. There were 9% of women working from home partially. Furlough became the minority, and most people who were furloughed returned to work. For men, the different evolutions were the same. In the end, there were very few differences between men and women, except for inactivity, which was higher before the first lockdown and which remained high. Another difference is that men more often than women continued working in person, and this was the case during both lockdowns. So, work carried out in person, this meant that people had to travel to their work site during the pandemic. Obviously, the health professions were those that were significantly exposed to the virus, and there was a shortage of masks during the first wave and a lengthening of their working hours. Professions in the first line and second line professions were in regular contact with the population during the different pandemics, during the different waves of the virus. Our second area of research is to do with the risk of contamination by SARS-CoV-2 during work during the first wave of the epidemic. This graph shows the proportion of the different working hours depending on the different socio-professional categories of employed people before the first lockdown. It confirms the stark disparity between the possibility of carrying one's work out at home or, on the contrary, the necessity to continue going to work during the first lockdown. As such, exclusive work from home concerned half of executives and compared to 1% of manual workers. In green here, you see that this affected more manual workers than highly qualified workers. Inversely, exclusive work from home was much more prevalent among executives. To study the links between these different working methods and the risk of contracting COVID, we used the symptoms that were most characteristics of COVID. So the loss of smell and taste. And so it's important to distinguish between the different contamination periods, so before or after the first wave of the epidemic. So our hypothesis is that right up until the first wave, so right up until the first lockdown, many people were affected given their exposure. Then, work from home meant that they were able to shelter themselves, whereas health professionals and lower qualification professionals had to continue going to work. Therefore, working from home was a significant measure to protect oneself from the virus during the lockdown at the very beginning of the lockdown. And this is what we observe. On this graph here, we can compare the risk of losing one's smell and taste among people who worked in person, at least partially, compared to remote workers. We distinguish two different periods. First, during the first wave and the second wave. This risk increased by 20% during the first wave, with a risk relative of 1.19 and 60% after the first wave. If you compare now the essential professions to others, we see that there is a significant increase after the first peak of the epidemic. Outside of health professionals, we see an increase of 1.35%. In conclusion, we must underline the robustness of our results, which were drawn from a longitudinal representative study that we conducted among 85,000 people. In particular, there was a transitory increase of furlough in May 2020 during the lockdown and a massive return to work in November 2020 with the organisation of hybrid working conditions. Working from home is a protective measure and protected executives and other intermediary professions. Essential professions were much more exposed, in particular in the health field, but also to a lesser extent outside of the health sector. Finally, the socio-professional gaps were more marked after the first peak of the epidemic or during, due to the significant disparities of the protection measures that were implemented during the lockdowns. Thank you very much for your attention.